Russell Broadbent here, member for Monash. Recently, the Department of Health reported that only 3.5% of 18 to 64-year-olds have received a COVID booster in the past 6 months. Furthermore, the latest figures from the Australian Immunisation Register show that childhood immunisation rates are falling. This phenomenon is not unique to Australia. According to the World Health Organization and UNICEF, vaccination rates are falling across the globe. Why could this be? One doctor says that COVID vaccination rollout has potentially shifted people's attitude, with vaccination rates falling across all age groups since 2020. This begs the question, did Australia's COVID vaccination policies contribute to this change in general vaccine uptake? If so, why? Let me run this scenario by you. Firstly, we were told to get vaccinated on behalf of everyone else to stop the virus spreading. Fair enough, that's reasonable. But then we learned that vaccine didn't stop transmission. So not only didn't it stop people contracting COVID, it didn't stop the spread. Second, the risks were downplayed. We now have over 140,000 reported adverse events to the TGA's reporting system, including 1,023 deaths. This is more reports than for all other vaccines in the last 50 years combined. The now withdrawn AstraZeneca shot was linked with clots and death soon after rollout in 2021, yet it took another 2 years before it left our shelves. That's a lot to digest. Australians now suspect something is up. The trust factor has been compromised. Many of us know people who have been vax-injured. I have interviewed many injured people on this channel. What else have we learned? We've learned that the conversation around benefits and harms of our COVID response was stifled. Our own Department of Home Affairs censored over 4,000 social media posts about COVID, many of which were later proven to be absolutely true. Yet recently, former CDC head Dr. Anthony Fauci admitted that he didn't remember reviewing any studies or data that supported masking children or social distancing, and that the rules just sort of appeared. But by far the most egregious insult in Australian people were the mandates. These were, and always have been, deeply unethical, especially when you are forcing people to decide between an experimental jab, a so-called vaccine which fails to prevent infection and transmission, and their job. Ex-CDC Director Dr. Robert Redfield recently confirmed this view, saying they never should have mandated vaccines, period. Of course, I'm not only inclined to agree, I agree. The falling vaccination rates may well be the most damning evidence we have that Australians' trust in the health bureaucracy has been irreparably damaged. So now people are voting with their feet. And that's justice as I see it.